How do standard precautions prevent infectious disease transmission? Have you ever wondered how healthcare workers keep themselves and patients safe from infections? The answer lies in something called standard precautions. These practices are essential in preventing infectious disease transmission. Let's break it down. Standard precautions operate on the principle that all blood, body fluids, non-intact skin, and mucous membranes might contain infectious agents. This means that healthcare workers treat every patient as if they could be carrying something contagious. By doing this, they minimize the risk of spreading germs between patients, staff, and the environment. One of the most important aspects of standard precautions is hand hygiene. Washing hands before and after any patient contact is crucial. This simple act removes or kills microorganisms that could lead to infections. Next, personal protective equipment, often referred to as PPE, plays a vital role. This includes gloves, gowns, masks, face shields, and eye protection. When there is a chance of exposure to blood or body fluids, wearing PPE creates a barrier that helps prevent infection. Another key practice is the safe handling and disposal of sharps, like needles. This prevents injuries that could transmit bloodborne pathogens. Healthcare workers are trained to manage these items carefully to avoid accidents. Aseptic techniques are also essential during invasive procedures. By using non-touch methods, healthcare providers can avoid introducing germs into sterile areas of the body. Cleaning and disinfecting reusable instruments and surfaces is another critical step. Proper cleaning reduces the risk of contamination in healthcare settings. Respiratory hygiene and cough etiquette are important too. These practices help limit the spread of respiratory infections, especially in crowded environments. Lastly, handling contaminated linen and waste properly is necessary to prevent environmental contamination. This ensures that germs do not spread beyond the immediate area. From a medical anthropology perspective, standard precautions reflected a culturally sensitive approach to managing infectious risks. They recognize that germs are invisible and everywhere, requiring consistent behaviors in healthcare settings. This universal application protects both patients and healthcare workers, regardless of the specific health issues involved. In global health, standard precautions serve as a baseline infection control strategy. They are essential in various cultural and resource settings. By applying these practices uniformly, healthcare systems can maintain safety, even when disease surveillance varies. Overall, standard precautions are a fundamental part of infection control. They treat all bodily substances as potentially infectious and apply consistent practices to interrupt the pathways of infection. This approach is vital in understanding how health systems worldwide manage infectious disease risks within diverse cultural contexts.